Hey, Dr. Deb here. I'm here with my friend and colleague, Dr. Kumar from Holistic Health MD. She's a physician who specializes in functional medicine and specifically hormone health, and she works with bioidentical hormones. So, Dr. Kumar, can you explain what are bioidentical hormones?
So bioidentical hormones are the hormones that are similar to the hormones that are created by you naturally in your body.
And what are some of the symptoms that women come in complaining about when they have a hormone problem?
So they variety. They can vary so much from one person to another. Things like palpitations. Your heart is racing in the middle of the night. You wake up in the middle of the night and with a racing heartbeat. Or you have hot flashes. You're sweating so bad that you need to go and change immediately. Or you just don't have enough patience like you used to have 10 or 15 years ago with your patients, with your children, or with your patients, or
just losing your temper, right?
Yes, yeah.
And some of those are not obvious. Like, I think a lot of women wouldn't expect heart palpitations would have anything to do with hormones, and that's part of your story, isn't it? How you got into this kind of medicine?
Yeah, it's crazy, isn't it? Because I had such bad heart palpitations. I used to be a neonatologist, and I would be standing in the delivery room having these hot flashes and palpitations, and I almost getting ready to pass out. Had $1 million workup with the cardiologist, and they told me to just take magnesium and go home. And so
they didn't find anything.
They didn't find anything.
And it turns out that it was menopause.
Absolutely.
Yeah. And so now that you have your hormones balanced, how are you feeling now?
Oh my God, it's a different world altogether. I think I have so much patience. My communication with my children has improved. If there is anything, that's one of the biggest rewards of having my hormones balanced. And I'm certainly very, very patient with my own patients. My communication skills have drastically improved.
Yeah, that's wonderful. So I think that when most women go to their doctor, what they kind of expect to happen is that they're going to complain that they don't feel good. And really what they're hoping for is hope and answers. And what they usually walk out the door with is another prescription for sleeping pills or antidepressants or something like that. But that's not what it's like when people come to work with you. Can you talk a little bit about what it's like at your practice?
So typically when women come to me, I listen. And it surprises me that when they walk, after I finish listening to them, one of the most common things they say is, nobody has ever talked to me, or nobody has ever listened to me for such a long time. So that is a big part of my care. The second piece is I do comprehensive lab testing on them to see where is the root cause of their problem. And the third one is then I make a very individualized plan for them based on what their root cause of the problem is.
And that's so different than what people are used to, and that's wonderful because you can do so much more. What message would you like to leave women with today?
There is hope. There are women that are not aging gracefully, and the menopausal or the perimenopause to menopause, women spend on an average a third of their life in that phase. And I think they're the most miserable in that stage. And I think that's total injustice, and that can be fixed.
Yeah, it doesn't have to be that.